thumbs up from all of you. If my audio video is fine, let me check as well if I am audible and visible to all of you. Very nice. So, welcome everyone in this dermatology session with me, Dr. Chesta Aggarwal, and we are targeting to complete a lot of images in this session. I am a dermatology educator on the best online platform, that is Unacademy, and I've myself scored All India rank 261 in my NEET PG entrance examination. I'll help you with the same. I will help you in clearing the concepts and doubts related to dermatology. Now, please remember that currently on Unacademy, we are going on with a very important discount, that is Unlock 20. You can get 15 plus 20% off when you buy a NEET PG Plus subscription. The offer is valid till 31st, and when you will go for payment, they will ask you for a code. Please use this code, and if you use this code, you will get 15 plus 20% additional discount. For Unlock 20, that is for NEET PG Iconic subscription, you will get 20% off. And again, they will ask you for a code. Please use this code CHESTA10 and get your Unacademy subscriptions. We have a NEET PG 2023 integrated system-wise batches where the dual educator approach would be there. I would be highly requesting all my students to kindly be a part of this particular batch group. You can enroll now using the same referral code, that is CHESTA10. It's a 5-month duration course which will start from August 21st, or which has already started from August, and I would be highly recommending all my students to please be a part of it. We also have a question bank 2.0 which is coming soon, so stay tuned. I would be requesting all of you to kindly get this Unacademy Lite subscription to start practicing your question bank 2.0. Now let's start with the first question of today's session. Let me just take you to the first question of the today's session. The pure image based session series. So a patient coming with itching in the groin since 2 months, all can cause this except. Very nice, all of you. The patient comes with itching in the groin since 2 months, all can be the cause. Please remember, whenever a patient present to you with itching in the groin and the plaque like this, which is the annular plaque with erythema, this is a very classical example of dermatophytic infection. And what dermatophytic infection we are suspecting here? Which dermatophytic infection we are suspecting here? It is either trichophyton, or it is either Tinea cruris or Corporus. We have only 3 species of dermatophyte, which is Trichophyton, Microsporum, and Epidermophyton. Aspergillus is not the cause, and that is why the answer to this question becomes option number 1. Aspergillus is not the cause of Tinea cruris or Corporus. We have done a very similar question just now in our special class. So can you tell me what can be the answer here? Ashutosh, Harmanpreet, Lion, Bhavdeep, Sambhav, anatomical explanation, Priya, Shravan, all. What is this? And this is done to document what? Very nice. It's a patch test, and this is done to document a delayed type of hypersensitivity. That is a type 2 hypersensitivity. It is a patch test which is done to document the delayed type of hypersensitivity. Next question. The patient was treated with steroids for psoriasis. On stopping the treatment, he develops fever, malaise, lesions as seen in the image below. What is the most probable diagnosis? Now, if you look at let me zoom this image for you so that it becomes more prominent. You can see that there are so many pustules which are discrete here, but these pustules are getting confluent. So, discrete to confluent pustules in a patient of psoriasis. What is the diagnosis? It's a very classical patient of acute generalized pustular psoriasis. When you give steroids in a patient of psoriasis, they either respond through pustule formation or erythroderma. Next question. 45-year-old male with itchy papules on the face, neck, V area of the chest for the last 3 years, which are exacerbated in the summers, improves in the winter. What test will you do to confirm the diagnosis? Everyone, Amarpreet, Priya, Bhavdeep, Aditya, Sambhav, very well done, all of you. Kamal, patch test, prick test, IgE level, or skin biopsy. A 45-year-old male with itchy papules on the exposed part, face, neck, V area. It means it's a patient of photodermatitis. Please remember, photodermatitis, it is a type of exogenous allergic contact dermatitis. And if it is allergic contact dermatitis, the diagnosis you will do is a patch test. To be more specific, you will do a photo patch test. There's no rule of doing biopsy here. Please remember, it's a patient, even if it is ABCD Shravan, even if it is airborne contact dermatitis, the diagnosis can be confirmed by doing a simple patch test. So this is a patient of photodermatitis and we will do a photo patch test to make a diagnosis. Okay. Next, 3-year-old child has itchy erythematous lesions on the flexures. Mother is a case of bronchial asthma diagnosis. So 3-year-old child with itchy eczematous dermatitis on the flexures. There's a history of bronchial asthma. The diagnosis should be atopic dermatitis, contact dermatitis, seborrheic dermatitis, or infantile seborrheic dermatitis. Yes, you are all right. Flexural eczema is a very characteristic feature of atopic dermatitis and a positive family history. So both give you an idea that this is a patient with atopic dermatitis. You can see a clinical image, the oral cavity lesion. There is a whitish patch on the tongue as well as on the palate. This is known as oral thrush. Can you tell me what is the another name of oral thrush? What is the another name for oral thrush? Acute erythematous candidiasis, chronic erythematous candidiasis, chronic pseudomembranous, acute pseudomembranous candidiasis. What is the answer? Very nice, Sambhav, Bhavdeep, Combat, Ashutosh, Paramjeet. The correct answer is option number one. It's very easy. The most common type of oral candidiasis is acute pseudomembranous, which is also known as oral thrush. Female developing this pigmented lesion, which increased in the size at the time of puberty. And on examining the lesion, we could see that there is some hypertrichosis. So let me show you the image. So there is a patch which is present on the trunk associated with increased pigmentation. What is the diagnosis? What is the diagnosis? Very well done, everyone. Very nice. This is a patient with a epidermal melanocytic disease, which is known as Baker's nevus, because it is increasing in its size at the time of puberty. In puberty, because of presence of androgen receptors on the Baker's nevus, they suddenly start increasing in its size. The common site is on the trunk, and you can get associated hypertrichosis or you can have associated acne form eruptions. Identify this condition. There is a whitish, soft to firm papules or nodules on the elbow. Very nice. Harmanpreet, Akhil, Neuron, Harika, Ashish, Lion, Sambhav, Aditya, Sangamesh, Mandal. Very nice, all of you. It's a very classical image of tuberous xanthoma, the lipid which gets distributed or deposited on the tendons. Tuberous xanthoma. Okay? Tuberous xanthoma. Very classical image of tuberous xanthoma. Please remember, phrynoderma, they are not like this. They are not whitish, yellowish papules, nodules. They are just follicular hyperkeratosis. They are follicular hyperkeratosis. So those who are marking, Option number 4, please remember they are follicular hyperkeratosis. But the image is totally different here. The image is totally different here. The correct answer of the question is tuberous xanthoma, not phrenoderma. It is tuberous xanthoma, not phrenoderma. A housemaid presented to dermatology OPD with these lesions in 15 days. What can be the diagnosis? A housemaid with the following lesions presented to dermatology OPD. What can be the diagnosis? Clear, all of you? So what is the answer here? A housemaid, when she present with the following lesion, it's a very characteristic irritant contact dermatitis to the detergent. Please remember, detergent dermatitis is the most common contact dermatitis we see in a lot of individuals. The correct answer of this question is option number 15. The option number 1, that is after 15 days, since 15 days patient presented with this lesion. This is a very characteristic image of irritant contact dermatitis. Moving to the next question. Now here, you have to look for a disease. I'll not tell you where is the condition, but let me focus this image for you. This female or this male presented to me with complaint of excessive itching. Can you see it here? There was an excessive itching and it is associated with a curvilinear lesion on the little finger. What can be the diagnosis? Very nice. It is a cutaneous larva migrans. Amazing. It's a pure clinical diagnosis. You don't need an investigation for that. And recently I've seen a patient, a single stat dose of ivermectin, the patient was improved. Okay? So single dose of ivermectin or sometimes albendazole will give you a complete cure of this condition. In which form of candida you will see satellite lesion? Can you see this image of a child with some erythematous patches on all the flexures? If you notice, it is present on the neck, elbows, axilla, groin. This is a very classical candidal infection. So, in which form of Candida satellite lesions are frequently seen? Candida Balanitis, intertrigo, oropharyngeal candidiasis, or Candida pyrrhonychia? The correct answer is option number 2, Candida intertrigo. Candida intertrigo. A 6-year-old child with these lesions associated with itching, what is the diagnosis? Can you see the lesion on the scalp? Let me zoom this image for you. You can see a lot of swellings which is associated with crust, matting of the hair, and you also get sinus discharges on the scalp. A prepubertal boy with the lesions as shown associated with itching. Amazing, all of you. Very nice. Sambhav, Lion, Bhavdeep, Aditya. This is a characteristic image of what is known as tinea capitis. And can you tell me which form of tinea capitis is this? It's an image of Kirion. Frequently asked questions in your exam. So this is a very classical image of Kirion, multiple lesions. Why this is not seborrheic dermatitis? Because seborrheic dermatitis it's a disease after adolescence. So will you see seborrheic dermatitis in a 6-year-old boy? No. So those who are marking seborrheic dermatitis, please remember that cannot be the option. It has to be tinea capitis and that too the variety known as Kirion. For more detailed discussion, I request all of you to please subscribe Unacademy. You can use my code and avail the you can use this code and avail the 15 plus 20% discount. The offer is valid only till tomorrow. A 30-year-old male presented with this annular plaque with central crusting, what can be the diagnosis? 30-year-old patients with annular lesion, central crusting. Annular lesion and central crusting. Annular lesion and the central crusting. What will be the answer? Annular lesion and the central crusting. Annular lesion and the central crusting. What is the diagnosis? Very nice. Very well done, all of you. Very well done. Now, whenever you see an annular lesion with See, there can be three DDs of an annular lesion. Annular lesion with scarring in the center. Scarring of the center. This is a patient of cutaneous tuberculosis or lupus vulgaris. When there is central clearing, it's a image of fungal infection, tinea. And when you see central crusting, it's a patient with central crusting is a patient with leishmaniasis. Patient with leishmaniasis. Okay, patient with leishmaniasis. The correct answer here is cutaneous leishmaniasis because annular lesion with crusting of the center. Annular lesion with crusting of the center. Please tell me the correct answer of this question. Let me just show you the image. Let me just zoom this image for you. A 35-year-old patient presented with photosensitivity and the following rash. Photosensitivity and the following rash. Very nice. Priyanshi, Bhavadeep, Lion, Priyanka, Safi, Sangamesh, Priya, Akhil. It is a very classical rash of SLE which is known as Melaresh. It is present on the butterfly area of the face, bridge of the nose, and if you can see, there are some lesions on the neck as well. So this is a patient, a young female with photodermatitic lesions, with SLE or Melaresh. What is the diagnosis? You can see multiple itchy blisters on the hand or on the forearm, drug rash, erythema multiforme, herpes simplex infection, or allergic contact dermatitis. And I'm giving you a hint that this is something which is important. The bangle of this patient is something which is very important. So anybody can tell me what this could be. Very nice. Please remember, it's a patient with allergic contact dermatitis to bangle. Bangle induced allergic contact dermatitis. It's a patient with bangle induced allergic contact dermatitis. Okay. So please remember, it is a patient with bangle induced allergic contact dermatitis and you develop vesicular eruptions at the site of contact. The answer is option number 1. Lesions seen in the rainy season diagnosis. The lesions frequently seen in the rainy season: piedras dermatitis, atopic dermatitis, flexural dermatitis, or dermatitis artifacta. And you can see a very classical kissing lesion. The same site, the mirroring of the lesions on left and right. So these are known as kissing lesions. Swati, the bangle contain a lot of agents. If the bangle is made up of metal, then nickel is the cause. On the bangle, you have a lot of decoration and they use adhesives for that. In adhesives, you have para tertiary butyl phenol, which is the allergen. The answer to this question is option number 1, that is piedras dermatitis. It's a type of insect bite hypersensitivity. It's a type of insect bite hypersensitivity which occurs because of the irritant material released by the insect during the rainy season. A patient with erythematous plaque on histopathology shows collection of neutrophils in the epidermis, suprapapillary thinning, but negative Auspet sign. What can be the diagnosis? What can be the diagnosis? Anyone? Very nice. Now, one thing which is clear with the help of the question, that presence of collection of neutrophil in the epidermis. Collection of neutrophils in the epidermis means micromunro abscess. It means micromunro abscess, and please remember, micromunro abscess is a feature of psoriasis. The only psoriasis which present on the flexures, they are inverse psoriasis. So the correct answer of this question is option number one. It's a patient with inverse psoriasis. Now I want everyone to tell me the answer of this question. Let us move it here. And now, can you see some fissures? Can you see some fissures on the penile shaft as well as the fissures on the glands or the papules? Now, tell me in which condition you develop the lesions. A man with the habit of frequent washing of the genitalia develop falling lesions in few days. What can be the diagnosis? Again, requesting all of you, if you want more such sessions, if you want the PDF of these sessions, please download the Unacademy Learning app and use this code, get your subscription today. Please use this code, get your subscription today. For today and tomorrow, we are giving you 15 plus 20% discount. So if you buy a 6-month subscription, that will be only rupees 50,000 or something, which is way too cheap than what we were giving it in the past. So requesting all of you to please use this code for more PDFs, for more such questions, images, etc. The answer is Candida Balanitis. Frequent washing, when you wash the genitalia frequently, it causes retention of the moisture. This retention of the moisture can sometimes give rise to the fissuring of the genitals, and this is known as Candida Balanitis. Candida Balanitis. Next question. Let's see how many of you can answer this. Safi, for this YouTube session PDF, you need to download the Unacademy Learning app and get the subscription. A child with yellow papules plaques on the lateral neck or the body, the skin biopsy shows increased calcification with clumping of the elastic fibers taken from the affected skin. What can be the diagnosis? 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 Amazing. Priya, Bhavdeep, Sambhav, Tripti. Now, this is a patient with pseudoxanthoma elasticum. And the appearance which is seen here is very classical appearance, which is known as Moroccan's leather, which is known as chicken skin appearance. In the patients of pseudoxanthoma elasticum, the elastic fibers are damaged. In the patient of pseudoxanthoma elasticum, the elastic fibers are damaged and they will give rise to wrinkling of the skin like that which is seen here. Next, 55-year-old female gives a history of these lesions in 6 years. The diagnosis. Please zoom the image. Okay, you want this? You want me to zoom the image of the last question or this question? Look at this image. This is a patient with some lesions on the plantar aspect. Swati, you want me to zoom the image of this question or the last question? This is a patient with acral melanoma. Very nice. It's a patient with acral melanoma. If the same lesion occurs on the nail bed, the nail plate will appear black. And can you tell me what is that sign called as? If the same lesion occur on the nail bed, the nail plate becomes black. And what is that appearance called as? That is called as, what is it called as? Very nice, all of you. That is known as Hutchinson sign. Hutchinson sign. When there is presence of the pigmentation on the nail bed, which gets reflected through the nail plate. Hutchinson sign of acral melanoma. Next question. Okay, tell me this question first. And let me first zoom this. Now, please remember the eyes of the baby is normal. This bluish color is to so that you cannot identify the patient. Please do not answer it as a blue eye disease because whenever I show this image, the students will tell that, ma'am, what is happening to the eyes? Eyes are fine. I've only put that so that the eyes can be hidden, the image can be, or the identity can be hidden. The thing which you all need to notice this part. Just below the lower eyelid, there is an extra fold. Just below the lower eyelid, there is an extra fold, and that is what. Yes, I know some of. I've already gone through this images and different views of the students. So please remember the eyes are absolutely normal. The thing which I want you to look at is the fold which is present on the lower eyelid. And I think now you can get the answer. What is this extra fold called as, Anshul? What is this extra fold called as? What is this extra fold beneath the lower eyelid called as? This is known as Denny Morgan fold. This is known as Denny Morgan fold. This is known as Denny Morgan fold. And this is one of the minor criteria of atopic dermatitis. Denny Morgan fold, one of the minor criteria of atopic dermatitis. A 35-year-old female with history of photosensitivity and ANA positive, what can be the diagnosis? 35-year-old female with history of photosensitivity and ANA positivity, the diagnosis. DLE, lichen planus, photodermatitis, and rosacea. 35-year-old female with history of photosensitivity, ANA positivity, what is the diagnosis? Amazing. This is a patient with DLE. So that is how the DLE lesions appears. The hypertrophic the atrophic hyperpigmented lesions on the sun exposed part. Atrophic hypopigmented lesions on the sun exposed part. This is a patient of discoid lupus erythematosus. A young female with itchy plaque on the face, what investigation you will advise in this patient? The investigative modality that can be done for this particular patient. Can you tell me the diagnosis? What is the diagnosis? A ring-like lesion, annular lesion with clearing in the center. Diagnosis. It's a patient with tinea faciae. And if it is tinea faciae, the KOH mount becomes the correct answer. It is tinea faciae and the KOH mount becomes the correct answer. 40-year-old male having history of dermatological disease since a very long time recently received an injectable by a quack. Develop these lesions. What can be the diagnosis? This is one of my own patient. He visited to us, I think, in 2019. He told us that he was treated by a quack by an injection which is white in appearance, white color injection. So what could be that injection which he has received? Anyone? Very nice, Shravan. You're absolutely right for the diagnosis. It's a patient with erythrodermic psoriasis, and that injectable could be a systemic corticosteroids, which has exacerbated the condition of the patient to the erythrodermic variety. The answer of this question is option number 1. It is not a drug rash. It is a very clear-cut erythrodermic psoriasis, which occur because of withdrawal of systemic corticosteroids. Can you tell me the answer? Identify the skin biopsy punch. Identify the skin biopsy punch. So it's, I think, very easy. I've already told you the answer. Please look at this. This is a very classical biopsy punch, which is done to take the biopsies of the skin. It is disposable, so after every use, you have to throw it. Please remember, this is the skin biopsy punch. You can get the questions on the instrument sometimes. Moving to the next question. Pigmentation of the tongue, pigmentation of the knuckles, crease, palmar crease. What is the answer? Vitamin A deficiency, B3 deficiency, B12 deficiency, or vitamin C? Anyone? Very well done, all of you. Please remember the correct answer of this question is option number 3. Vitamin B12 deficiency is known to cause pigmentation of the skin as well as mucosa. So the answer is option number 3. Causative agent for this condition. Causative agent for this condition. Causative agent for this condition. Corynebacteria species, Propionibacteria species, Demodex species, or Mycobacterial species. What is the causative agent for this patient's condition? Very nice. This is a patient with pitted keratolysis, and please remember Corynebacteria infection is the correct answer. It is not mycobacteria, it is Corynebacteria which causes pitted keratolysis. It's a superficial bacterial infection of the skin which is precipitated by increased sweating. Next question. First of all, I'll show you the image. Look at the image. There are ulcers which are present in the oral cavity with the white base, red margin. White base, red margin. Tell me, what are these ulcers called as? What are these ulcers called as? Anyone? What are these ulcers called as? What are these ulcers called as? What are these ulcers called as? Patient presented with recurrent oral lesions. As shown, he recently started joint pain and eye manifestation. What is the diagnosis? Very nice. The correct answer of this question is option number 1. And the ulcers are the aphthous ulcers. Presence of aphthous ulcers, joint pain, involvement of eye, they are features of Behçet's disease, which is a neutrophilic dermatosis. Patient with these lesions, the biopsy shows suprabasal acantholytis and disc keratosis. Suprabasal acantholysis and disc keratosis. Look at the neck lesions. Let me show you. The dirty neck appearance of this patient with the characteristic biopsy changes. What is your answer? Anyone can tell me the correct answer of this question? Very nice. The correct answer is option number 1, that is Darius disease. Dirty, warty, hyperkeratotic lesions on the seborrheic areas, very characteristic of Darius. Plus, you have suprabasal acantholysis and disc keratosis. Haley disease will present with erosions. It will not present with dirty papules like this. Haley disease, the presenting feature is presence of erosions. Okay. Tell me what is the answer. Identify the instrument. Ambi's knife, Mollison's retractor, Hoover's elevators, or Doyen's retractor. I think everybody can answer this. It's a very clear-cut image of Humby's knife. And what is the role of Humby's knife in dermatology? What is the role of this instrument in dermatology? Anyone? You will use this instrument to graft the skin, the pigmented skin on the vitiligo. So it is used for skin grafting in the patients of vitiligo. In which genodermatosis the following findings are seen? Neurofibromatosis 1, bone villei disease, Bloom syndrome, or cocaine syndrome. In which genodermatosis the following finding is seen? It is subependymal tubers. Subependymal tubers. In which genodermatosis the following findings are seen? The correct answer of this question is, anyone? The correct answer of this question is tuberous sclerosis, that is bone villi disease. Tuberous sclerosis, that is bone villi disease. It is not neurofibromatosis 1. It is bone villi disease. Patient presents with painless ulcer which bleeds on touch. Patient presented with painless ulcer which bleeds on touch. Donovanosis, lymphogranuloma venereum, syphilis, or herpes genitalis. Very nice. Whenever you see an ulcer with red exuberant ulcer, this is a patient with donovanosis. Okay. Now this, let me see how many of you can solve this question. This was one of the patient which was referred to us by psychiatry department with the following skin lesions. She was a mentally ill patient with a very poor surroundings, poor hygienic condition in which she was staying. What can be the answer here? If you want, I can zoom the image for all of you. Is this clear, everyone? Am I audible and visible to everyone? Let me check. Am I audible and visible to all of you? Very nice. Let's move to the next question. A 35-year-old patient presented to us with pain over the extremities on the exposed area. For examination, following facial features are present. What is the diagnosis? Systemic sclerosis, morphia, dermatomyositis, or systemic lupus erythematosus. If you look at the face of this patient, can you see there is a very characteristic purse string mouth appearance? A very, very characteristic purse string mouth appearance, which is noticed in this patient. In addition to that, you have Raynaud's phenomena. In addition to that, you have Raynaud's phenomena. In addition to that, you have Raynaud's phenomena. This is a very characteristic feature of systemic sclerosis. A very characteristic feature of systemic sclerosis. Now, the next question. I want you to look at the image, everyone. This is very important. Let me zoom the image for you. These are the grouped vesicles. They are vesicles. Grouped vesicles on the penile shaft. What is the organism responsible? What is the organism responsible for this patient's condition? Shravan, in the previous image, if you look at the face of the patient, it was purse string mouth. Purse string mouth. In the previous question, if you ask me, the mouth of the patient is known as purse string mouth. Can you see this image? This is a very characteristic purse string mouth. It indicates that the patient has thickening of the facial skin. In addition to that, if you have Raynaud's phenomena, this becomes a case of systemic sclerosis. The answer here is herpes infection. The answer here is herpes simplex infections. Okay? The answer is herpes simplex infections. Dermatitis neglecta. Okay, Shravan, in dermatitis neglecta, what happens? The patient with psychological disorder, they will not take care of their body. The local hygiene is very poor. So what happens when they do not take bath for a very long duration? The dirt, the skin, they all get accumulated. The normal skin exfoliation is not done. And when the normal exfoliation is not done, you will see some keratotic lesions with dirt deposited on the skin. For treating this patient, you just need a simple warm saline compressions. The saline compression will actually cause loosening of this sticky material, which could be a skin part or which could be a dirt, and the patient will improve automatically. You don't need to give any treatment for that particular condition. Clear, Shravan and Vikram? Which dermatome is most affected? Which dermatome is most affected? A patient with this particular type of lesion, can you tell me what is the answer? This is a diagnosis of herpes zoster. And in herpes zoster, please remember the common dermatome is thoracic. But in this particular individual, it is the lumbar which is the most frequently affected. Okay. Next question. We have only 3 minutes with us and we are done with the session. A boy from Kashmir presented to us with the following scalp lesion. On doing the Woods lamp, it shows a dull blue fluorescence. Diagnosis: seborrheic dermatitis, favors moth-eaten alopecia, and dissecting folliculitis of the scalp. You can see that there is a lot of scarring and there is a very classical yellow colored crust which is known as scutula. There is a very classical yellow color crust which is known as scutula. This is a diagnosis of favors secondary to trichophyton Sean-Laney. This is trichophyton Sean-Laney. Okay, so this is a boy with favors. Let me zoom this image for you. This is a patient with favors. You can see that there is scarring. There is some thick yellow colored crust. It is not cradle cap. Aditya, in cradle cap, you will never see scarring alopecia. No, you will never see scarring alopecia in a patient of cradle cap. Now, before that question, I want you to answer this. A 20-year-old girl living in hostel developed intense itching in the scalp since a few weeks. Section of the hair shaft is shown in the image. What is the most probable diagnosis? Dissecting folliculitis of the scalp is a bacterial infection. The presentation is not like that of Favus. Favus, why that is the answer in this question? Because first, Kashmiri descendant. It is very common in Kashmirians. Second, presence of that yellow colored crust. And the third is scarring type of alopecia. This is a patient with pediculosis because you can see a lot of nits which is mainly present on the hair shaft near to the scalp margin. The nits are present on the hair shaft near to the scalp margin. Swati, in white piedra, the whitish lesions, they are present uniformly throughout the length of the hair. But if you look at this image, you can see that the lesions are mainly present towards the scalp margin, not throughout the scalp. Identify these organisms: scabies mite, head louse, demodex, or trichomoniasis. Identify this diagnosis. Anyone? What is the diagnosis here? Identify this organism. Please remember the correct answer of this question. The correct answer of this question is this is a demodex mite. And what is demodex? A causative agent of, it is a causative agent of rosacea. Okay, so that is a demodex mite. So with this, we are done with the today's session. I hope everybody have enjoyed this rapid fire image based session. Now, before going, let me just show you the offer again. So at Unacademy, we are offering this offer of 15 plus 20% discount. This offer is only till 31st. Please use this offer using a code CHESTA10, CHESTA10, and get your Unacademy subscription. We have lot more of such sessions with all the subjects here. So don't miss out the opportunity. So thank you all of you. Good day and take care. I hope you have enjoyed this class. For more such session, please stay tuned on the same YouTube channel. You can also find me on the Unacademy Learning app. Just go to the app, download it, and search Dr. Chesta Aggarwal. And for the paid classes, you need a code, and the code is given on the screen. That is Chesta10. Thank you all of you.